Good morning.
Good morning.
Good morning.
Good morning.
Good morning.
Oh my God.
Good morning.
Good morning.
All right, everyone. Well, it looks like pretty much everyone's here. So probably what we'll do, since there's so many people on the meeting, we'll just make sure that everybody's muted unless you're talking, if that's okay. This is excellent. What a great turnout. We have 131 people now at our meeting. So my name is Jody Etchart, and I'm co-chairing this with Mr. Tony King. So I'll be taking care of the first meeting. And what we want to do to make sure that all members of the public and everybody know who's on the meeting, I'd just like for members of this task force to be able to introduce themselves. And again, to avoid any feedback, if anybody could mute if we're not talking. And then let's do just a brief introduction, say your name and just the entities that you represent. Thank you.
Do you need a volunteer to go first?
Yes, Amy, that looks like it's you. Good morning.
Good morning. I'll go first. I'm Amy Narrison, and I represent American Medical Response, which is provides ambulance services throughout Gallatin and Yellowstone counties. And then I also represent the Montana Psychiatry Association.
I'm Gail Tronstedt. I'm a public member on the Montana Board of Pharmacy.
I'm Kristen McCauley. I am on the Board of Nursing and so represent registered nurses and advanced practice registered nurses.
Morning, Madam Chair. Go ahead.
Stacey Anderson. I'm here on behalf of the Montana Primary Care Association, and I have several other clients in the healthcare space.
Morning, Madam Chair. Ed Budgery. I represent the Montana Hospital Association, also a legislator.
Morning, Madam Chair. Jason, Montana AFL-CIO.
Hi. My name is Najla. I'm from Brazil. You are registered nurse.
Najla, we're only doing members of the board. And so thanks for joining, but you're a public member. And then also we need G. Honeycutt, Mike Green, KKFRO to mute your microphones, please. Otherwise, we can just have the staff mute everybody so that there's less feedback, please.
Madam Chair, this is Brad Longcake. I'm here on behalf of the Montana Funeral Directors Association as well as the Montana Dental Hygienists Association.
Madam Chair, this is Senator Mark Nolan.
Morning, Madam Chair, Representative Josh Seckinger.
Morning, Madam Chair. This is Jen Hensley. I represent the Montana Academy of Physician Assistants, Montana Speech Language Hearing Association, Montana Occupational Therapists Association, and other healthcare clients that are interested in licensure.
Madam Chair, Webb Brown, representing dentists across Montana.
Is tax scam contingency.
Good morning, Madam Chair. This is Tony King, Montana Pharmacy Association. I'll be co-chairing this committee as well.
Good morning, Madam Chair. I'm
Melody,
Melody
you're a
Rice.
member of the public. We don't need you to introduce yourself, and I could have you mute your microphone, please. Thank you, though, for joining. We're really happy that you're joining. This is just for committee members. Thank you. Did we get everyone?
Good morning,
Good
Madam
morning.
Chair. This is Serena Brewer. I am a physician representing the Montana Medical Association and the University of Washington School of Medicine in Montana.
Good morning, Chair Etchart, Charlie Brereton, Director of DPHHS.
Hi, this is Tom Reed, Medical Oncology. I'll be starting at the Sletton Cancer Center in April.
Good morning. This Excellent. I think we have everyone. Thank you everyone for joining so much today. What I would like now is the staff that are helping us out. If you would please introduce yourselves. Thank you.
Hi, everybody. I will start. My name is Erin Sullivan. I'm policy analyst with the legal division at Department of Labor and Industry. I will be the staffer for this subcommittee and will do my best to help Representative Etchart and Tony King facilitate this group. So happy to be here.
My name is Jennifer Stallkamp. I am the General Counsel for Transactional Work with the department's legal unit and am here to answer your legal questions.
I'm Lisa Patzer, and I just am trying to manage the technology.
And Representative Etchart, I believe Sierra Reisberg didn't get a chance to introduce herself, but I do see her on.
Also, apologies for interrupting. My name is Dr. Austin Davis. I'm the president of the Montana Chiropractic Council. Just wanted to let you know we're on as well and interested in what the subcommittee is doing.
Are you a member of the committee, sir? I don't think you're a member of the committee. We're just doing task force introductions for the actual members appointed by the governor. But I appreciate that you're on. Thank you very much.
Thank you.
Hi, can you hear me?
Yes.
Okay, great. Yes, this is Sierra Reisberg with the Behavioral Health Alliance of Montana.
Excellent. Ms. Sullivan, did we get everyone?
I believe so, unless Senator Zolnikoff has made it on. That is the only one that I am showing that maybe didn't get a chance to introduce himself, but I'm not sure if he's made it.
Excellent. Well, if he pops in, we'll just allow him to introduce himself and we'll keep moving. Again, thank you everyone for coming. What our purpose is here is the executive order that the governor signed in January is going to build on Montana's multi-year effort to ensure that regulatory framework protects the public while also supporting workforce growth and access to services. So the purpose of this task force is to identify and remove barriers that are not necessary, and we still protect public health, safety, and welfare and improve timely and affordable access to healthcare services in Montana. This is not about dismantling safeguards. It's about ensuring that licenses requirements are justified, efficient, and truly serving the public interest. So this task force will focus exclusively on healthcare licensure. There are 4 other task forces that will discuss other sectors involving the governor's task force licensing initiative. And so those are barriers, construction, sunset, other, and then of course this one's healthcare. So we want to make sure that we limit our comments to issues that are going to affect healthcare because we are on a very short timeline. We are required to submit a report by September 2nd, and Ms. Sullivan will go through a lot of what's on that report that we are required to submit to the governor by that time. So she's also made a very structured, excellent worksheet that you should have all received in a packet this morning about where we're going to move going forward so that we have an outline of where to move. And of course, this is an outline. We can do anything that the committee decides to do within the scope of the healthcare task force. So I just want to say there's a whole bunch of people right now. We're up to over 200 people. So when we move to public comment, I'm going to say this multiple times so everybody knows, do not repeat anything that was made in public comment before, and then we'll probably limit public comment so that everybody gets a chance to talk because that's very important. So thank you so much. And I'm going to turn it over to Ms. Sullivan to talk about the worksheet that she has so expertly made for us this morning.
Thank you very much, Representative Etchart. So I will apologize right now. I know we're getting off to a very quick start, as it relates to these subcommittees and the work that we have to do. And so I do apologize that I didn't have this information out to you any sooner, but hopefully you all received an email from me about an hour ago. And what was in that email is a contact list with the subcommittee members. And then there's also some healthcare licensee data, and this will be posted on our website as well. And so the public will be able to see this information. But the data that was requested by the co-chairs is all on that document that is called healthcare licensee data. And primarily what they were interested in having, just kind of as a big picture, is by board or program, if it's a board that's healthcare related, what the makeup of the board is. And so the number of members on that licensing board and what their professions are. And then also for each board, what all the different individual licenses, that are available, and then also how many we currently have licensed. And so our licensing team was able to pull that information together, and so we put that into that document for you. I'm happy to go through it in more detail if anybody has questions on it. The other piece of information that's in there that was requested was if the occupation is currently an apprenticeable occupation. And so if that alternative pathway is available, then you'll see there's a little asterisk next to that occupation. So that's just some background information for you. And again, I'm sorry that I couldn't get it out earlier, but we'll get into a good rhythm pretty soon. So what I'd like to do is go through the Word document, this called Initiatives and Priorities Worksheet, with everyone. And we'll just kind of walk through it piece by piece, and this is going to help inform the committee or the subcommittee of what priorities are desired by the entire subcommittee, what topics you want to address, and also and make sure everyone's muted, please. And also kind of starting to set the schedule of how we're going to accomplish all of this by August. So you can see on the very first page, I'm just restating the two main focuses of the entire licensing task force through the governor's executive order, and that is identifying and removing burdens and barriers faced by licensees that are not necessary to protect the public, and improving access to and availability of professional services for citizens across Montana, including rural communities. So that's the entire task force's charge. Both of these topics are likely relevant to this subcommittee. And then underneath that, you can see there's subcommittee member topics. And so that'll be the first little work session that we'll go through today. So at the organizational meeting, the commissioner and several of you put out some potential member topic ideas. I have listed those in this table, and it's in alphabetical order, so there's no rhyme or reason to the order of it other than it's alphabetical. And so the topics listed that were identified that could be healthcare related are administrative burdens, apprenticeships, continuing education, portability and compacts, the Rural Health Transformation Program, and scope of practice, stackable credentials, telehealth, and workforce shortages. So those were the ones that I took down in my notes. I probably didn't capture everything, and you've probably thought of stuff since. So this first section of this subcommittee is to really kind of do some brainstorming and getting ideas out there from what you've heard from your stakeholders, from your areas of what this subcommittee could tackle. And so I'm just going to take notes, and Representative Etchart, I think if the committee members raise their hand if they want to speak, if you want to call on them or if you want me to, either way.
Thank you, Ms. Sullivan. I believe Senator Zolnikoff is on. Senator Zolnikoff, would you introduce yourself, please?
Yeah, Daniel Volnikov, Senate District 22 in Billings, and I've been on the Business and Labor Committee 2 sessions, once in the House, once in the Senate.
Thank you, sir. So, Ms. Sullivan, thank you very much for all of that information. What I wanted to do is I wanted to turn it over just for a minute to co-chair Tony King to discuss anything he'd like to add to our comments. before we go into the member topics. Mr. King, are you there?
Yes, thank you, Representative Etchart. And I just really also want to throw out a huge thank you to Ms. Sullivan for putting all this stuff together. I know it was a tight timeline, and we have some really good work to do and a short turnaround to do it. So, excellent work getting this together and putting it in the format that will help us stay organized here. It's really good stuff. In our original meeting on Tuesday here, it was pointed out several times about the apprenticeships. So I think this is a really good opportunity for us to take a look at all of the healthcare setting in Montana and really look for opportunities to enhance any sort of apprenticeship that we can get into. I think there was a sheet that was given to this committee that healthcare comments that I read through today, and I see in there's a number of times in which cost of the license was brought forth. So I think that's something that we can look at. There was a couple comments in there that dealt with scope, and I know that this is on our member topic ideas, but I want to be very careful with scope discussions in this, as the intent of this task force is about licensing and making it easier to get more folks into the workforce. So I'd like to kind of steer us into licensure apprenticeships. What are we doing? What kind of need are we seeing in the communities, and probably less of the scope discussions, at least especially early on in this, so that we can get a good idea of what we want to look for. The other thing, and I apologize for not giving this to Ms. Sullivan, I think our big sheet that has it in there, maybe in addition to where you highlight the apprenticeships, maybe if it's a compactable license as well, if we can get that updated in before the next one, I think that'll help us. I know we have a lot of compacts, and I know that there's some that we're not participating in. So if we can highlight that, maybe that'll give us a better idea of what we can do state to state. So I think I'll just stop there. We got a lot to do. So Representative Etchart, if you're okay, we can open it up to our committee of other things that they'd like to discuss.
Excellent. Thank you, Mr. King. Absolutely. So I just want to reiterate what we're going to right now is this is not public comment. This is where all of the members of the committee can go forth and talk about the issues that Ms. Sullivan made on her sheet. So what I want to do is open it up first before we go to the items that Ms. Sullivan broke out. I want to open it up to the task force committee members to discuss areas of interest and topics going forward. Ms. Anderson.
Good morning, Madam Chair. Again, Stacey Anderson, representing the Montana Primary Care Association, which represents Montana's federally qualified health centers and employs almost every healthcare license that is available under Montana law. One of the things I've been thinking about since our meeting earlier this week really is about emerging pathways and thinking through what are some administrative challenge or opportunities that the state can look at, because we only meet biennially. When, for instance, Medicare opens codes for community health integration that you can bill for auxiliary personnel that the state hasn't yet recognized, giving up 2 years of revenue, giving up, and then subsequently passing a bill or not passing a bill, thinking through what are some emerging pathways that the state can think about, some of these new certifications that we want to be able to capitalize on and add for portability for our own workforce. So thank you.
Thank you very much, Ms. Anderson. Representative Buttrey.
Thank you, Madam Chair. I've just got a couple issues that I've been responded to. I had sent out to the hospitals just a request for any items that they wanted brought forth to the task force. Interestingly enough, the first one is coming from the employer of licensees, which would be the hospitals. And this is actually something that might be more administrative rather than policy. I think it's good for this committee to hear. It may be something the department could try to address independent of bringing a bill forward, which is a good thing. But the state, it sounds like the state does not allow hospitals to automatically verify provider licenses, which they need to do each month for any member with privileges. Maybe because there's a CAPTCHA place that prevents auto verifying. I'm not sure why it is, but these medical providers have to go through every month and verify the licensure status. If there was a way that they could automate that versus having to have folks do it manually one at a time, that would be a big benefit for the employer of licensees. The second one is there's been a lot of discussion about licensees, Montana licensees that have national certifications. Certainly, many of our members would like, for the state just to accept the national certification. I don't know whether that's realistic or not, but in the case where that wouldn't be realistic, there are time frames that differ. So, for instance, maybe a state license is good for 2 years, but the national licensure might be good for 3 years. It would seem to be a huge benefit to the licensees if we could match those time frames. And then the last comment that I generally received was just dealing with the background checks, which can be fingerprinting, can be other things that have to be accomplished. That seems to be a very labor-intensive process. I know some of that involves the feds, but if there's a way that we could speed up that process, we could get folks to work quicker. Thank you, Madam Chair.
Thank you so much, Representative Buttry. Ms. McCauley.
Hi, yes. So the Board of Nurses stood behind the desire to support the compact for the APRN. It didn't pass. And I think that there's a connectivity between portability compacts, telehealth, and workforce shortages when we look across those three. And generally, there's some limitations from the professional organizations for the desire to allow compacts for the advancement of independent nursing practice, which I understand. And for for Montanans, we have some awesome hospitals, and we often send them out to these other bigger hospitals, burn unit in Salt Lake, specialty care at Mayo Clinic, pediatric trauma in Colorado. And I think there might be a place and a consideration that I'd like us to consider is maybe some sort of like a sponsorship licensure, where we can maybe through an abbreviated licensure have a specialist that's already seeing a Montanan through a sort of transfer like that, where we can expedite a licensure with their permission, of course, that would allow them to be licensed in the state of the Montana for the term that's already decided upon, that allows then our people, our residents, to come back home and do some more telehealth through that versus having to fly out to Salt Lake, fly out to Colorado for these in-persons. And I think that I carry licenses in a couple other states because people are so portable and they need it. And by having sort of a temporary licensure, if you're having difficulties within your own license, you might be inclined to expand your practice in the state of Montana. And I think it would have the possibility of making us recognizable, ready for specialists that are already taking care of our Montanans.
Do I see any other hands up?
Madam Chair, I can't find my hand button, but consider this my hand. So
go ahead, Ms. Hensley. Thank you.
Thanks. So I think these are really some creative conversations in the future. I'm super excited about the brains in this group. I did receive some comments that I'm not sure are within our scope or not. So perhaps we're going to activate that parking lot. But a lot of my clients have issues around commercial insurers and the time it takes to get credentialed with them prior to even billing. So though I know we don't have supervisory power over our commercial insurers, certainly less so over our out-of-state and ERISA plans. Maybe that's something that can be talked about in another space, but I know that that's one of the really big licensure issues that many of our members face.
Senator Zolnikov. Thank you, Ms. Hensley.
Thank you, Madam Chair. Yeah, I guess my big one is ensuring that Montanans are not restricted from utilizing who they want to across the nation of people who have very similar credentials, who also then require additional licensing in Montana, although they've gone through all the years of school to become doctors and whatnot. And we're just limiting their ability to, say they moved here, keep their doctor, or say they found a specialist they like somewhere else, utilize that doctor via new technology that isn't even new anymore. It's like 30 years old to maintain those relationships or build new ones. So I just want to make sure that our licensing is not creating barriers to entry or preventing consumers from accessing who they want to have as a physician or person in healthcare. Thank you.
Thank you, Senator Zolnikov. And Mr. Brown.
Thank you, Madam Chair. I want to go back kind of a 30,000-foot question. Is there any data or evidence that licensing is actually restricting the workforce in Montana? I think I'd like to see some statistics showing that that's actually the case. I'm happy to participate in this process, but I just am wondering if there's even a need for it at this point in time. Could save us all a lot of time and trouble, I guess, overall. So we'd just like to find out if there is some data that shows where there are the tight points that we need to look at specifically. When I do outreach to the dentists in Montana, I don't hear a lot of problems with the licensing. I hear issues other places. And as far as workforce, again, that's not a prerogative of the licensing boards, but I think the Rural Health Transformation Program is an excellent place to have that conversation about workforce. But overall, I would just like to see what data there is showing that there is a restriction in Montana. The conversations we've had with the department and the applicants, it seems to be pretty timely. They seem to be following the guidelines for other states. So that's my question. I'd love to see that data overall. Thank you.
Thank you so much, Mr. Brown. So, Ms. Sullivan, did you kind of catch that question from Mr. Brown, and we can make sure that we answer that question for him as it pertains to the committee going forward?
Yes, thank you, Representative Etchart. I did hear that, and if that is something that that the committee and you, Madam Chair, would like to see a presentation on or some sort of a background paper on, I can start pulling that together.
Okay, we can also save that towards the end too and see how much stuff we've got going on and what ends up pertaining the best. And also, I just want to remind members of the public, if you're not called on right now, it's because we're not to public comment yet. We're still working on actual task force appointees. So if you're not called on, don't worry about it. And I'll ask everyone to please mute your microphones. Thank you. Senator Zolnikov, did you have another comment?
Yeah, thank you, Madam Chair. I just wanted to clarify one thing. This is brought to find those issues. Having to prove that there is an issue before even holding these meetings would be impossible and counterproductive. It's considered the concept of proving your innocence. It is logically nearly impossible to figure out what the problem is without bringing people to the table, not proving there is a problem and then finding a resolution. So just keep that in mind. It is not the point of this committee to find if we need to even exist. It exists. Now the question is, are there issues? If there are none, there will be a report that says there are none, and we will disband. If there are some, then there will be a solution brought forth. So I don't want to get this committee wrapped around the axle trying to prove its existence. I think it's better to open up the doors, hear what we need to hear, find out if there are any problems. And I'll just leave it with this. About 10 years ago, there was a tour going around the state asking if the businesses around what the state could do better to make them succeed. Well, they asked the businesses that were operational. They did not ask the businesses that had not succeeded, failed, and had problems, in which then we could get barriers removed and out of the way. So keep in mind that it's not the ones who are succeeding that are always the ones we should be asking the questions to, but who ran into problems that do not exist in today's environment in healthcare, and what did they run into? What barriers to entry and problems? That's the questions we need to be asking. So asking those who succeed and work within the system today is not going to always give us the solutions to the problems. So just keep that in mind. Thank you.
Thank you, Senator Zolnikoff. Ms. McCauley?
Thank you, Chair Etchart. On that brief comment or concern about problems with licensure and restrictions, just generally there isn't clear definition on where you can practice with a Montana license. It's generally believed, seen that you have your patient has to be in the state of Montana, and you need to have a license both in the place where you are practicing and at the location of your patient. And so there is restrictions based on that. If our patients are out of the state, that makes a limitation and a restriction. And then furthermore, if there's a specialist in another state and we're in Montana, they can't be taking care of people in Montana without a Montana license, the way it reads now. Thank you.
Thank you. Ms. Reisberg?
Madam Chair, I'm Sierra Reesberg with the Behavioral Health Alliance of Montana, and behavioral health organizations have also identified similar issues as the Montana Hospital Association. So just want to note that this is a similar concern that's impacting across multiple professional license types. Thanks.
Do we have any more members of the committee that want to discuss any of the issues and where we need to focus this? Okay, what I would like to do is, can everyone please mute their microphones? Thank you. So what I'd like to do is open it up to the member topic ideas that came out of the first meeting that we had. And let's discuss administrative burdens. And I know we already discussed a little bit of that, but I just want to go specifically over that and see if members of the committee have any other brainstorming issues that we'd like to add under administrative burdens.
Madam Chair, this is Tony King. And I don't know if this is pullable info, Ms. Sullivan, but do we have reporting inside DLI of the average turnaround time for a new application?
Thank you. I believe so. I have a couple of our licensing experts are on, and they can feed me data. They promised that they could feed me data, but there is they do keep track of the average turnaround time for license applications, and so that is something that we can get for healthcare specific occupations.
Thank you.
And I would say, I'm sorry to interject, but I would say that the topic of administrative burden can be it can be a larger umbrella. So if you're talking about background checks and licensing costs and all that kind of stuff, that all kind of goes into could go into administrative burdens if you guys wanted to kind of lump that together and look at that, look at those all together.
Well, and I would I don't think this is easy data, but the average cost of license per the wage of the position, I don't know that that's a good pullable data. I know we had public comment asking to look at costs for certain licenses, but I don't know how to reference that.
Okay, yeah, that may take a little bit longer to get that information pulled. And we'd have to see, I'll have to check with our economists and see what kind of wage data they have. And so, but we definitely have the licensing costs per board and per license. And so that if we can get that first piece of information about the wage data, the state wage data, then I think we could probably pull that together.
Okay.
Are you wanting it for every single license type for healthcare, or do you want to?
That's a lot of work.
It's fine. It'll just take a little bit longer, and but if we're happy to pull that information for you guys if that's of interest to everybody.
We can prioritize that too at the end and see how long this list is getting to. So thank you very much. And then also in terms of these kinds of things, Representative Buttrey had talked about different areas under the administrative burden. And I see Representative Buttrey, you have your hand raised. Can you go ahead and speak to this and anything else that you felt was important, please?
Yeah, thank you, Madam Chair. I think it's a good idea if we looked at the background checks as well as the issue I brought up with the not allowing for the automation of the licensing checks. If we could put that in the administrative section, I think that would fit well. And then just to pile on the work for the department, I would have interest in knowing per licensing board the frequency that they meet. And I think screening panels might be called kind of as needed at will, but if there's a frequency set for the screening panels as well, I think a real barrier to licensure is somebody coming in and wanting to practice, but now they're waiting for the licensing board to actually schedule a meeting or to have a meeting. That could be a problem. Of course, if we increase the frequency of those meetings, then we're talking about additional legislative appropriation to pay for those meetings. So that's at least something the legislature could try to balance. Thank you, Madam Chair.
I do have some information, Representative Etchart, already.
Excellent, Ms. Sullivan. You guys are amazing. Go ahead and share it. We appreciate you.
So this is from our licensing bureau. There is the average is 5.8 days from submittal to initial review. And so as we always say to boards and to everybody, that if the application is complete, if all of the pieces are in there and submitted, then it's a lot faster to review. If there's back and forth between the licensing division and the applicant on getting data, then that can make it go a little bit longer. The days to licensure on average for 2024 was 45 days, and that involves, like I said, waiting on applicants to get the licensing division information. And so, and then we'll work on getting 2025 data for you.
Excellent. Thank you so much. Any other comments from
Madam Chair? Madam
Yes,
Chair, I have
Ms.
a question from Ms. Sullivan. The days to licensure average is 45. Is there a way that we can see maybe a mean as well? I want to see basically the spread, any outliers, are the majority of them 45, et cetera?
Okay. Yeah, like I said, I have our experts that are sitting here listening, and so they'll be compiling this data.
I'm aware there's good data crunchers in your department, so thank you.
Excellent, everyone. I really appreciate the comments. So next, let's move on to, I'm going to go up and down and out of alphabetical order just to change it up a little bit, Ms. Sullivan. But let's move to portability and compacts. I believe that Ms. McCauley talked about APRNs. We also have an EMS compact, a social work compact. I think there's a dental hygienist compact, and I know I'm missing one. I just don't know which one it is. Ms. Sullivan, do you have that data before we open it up to committee members to discuss portability and compacts?
I can grab it. I think if you could slowly repeat what you had said, then I can get the rest for you.
Social worker, APRNs, EMS, dental, and dental hygienists, and I cannot remember the other one.
Madam Chair.
Don't forget laboratory, folks.
Yes.
This is Jennifer. The other one that we discussed was the cosmetology compact, which is not healthcare related, but
Yeah, so it is those the 4 healthcare related compacts that the state is currently not a member of are those 4 that you said. There's an EMS compact available, social work one that was proposed last session, and it did not pass. Same with the APRN compact that's been proposed a couple times, and then there's a dentist and dental hygienist compact that's actually both occupations are combined into the same compact. So those 4 are available for proposal.
Excellent, thank you. And I'm, again, sorry, members of the public, will open it to members of the public in a little bit, but for now, this is task force appointees only. Mr. Brown.
Thank you, Madam Chair. I want to go real quickly back, didn't catch you in time on the administrative burden. To Senator Zolnikov's point, I'm sure the license application process also shows who did not get licenses, and that would be very good to add to the list. And if there's any way, I think you should be able to, with confidentiality and everything, show why they did not get the license. So that would be great data to have as well. And then as far as the compacts, we had looked at the dental hygiene compact, had not decided to move it forward during the session, based in part on the fact that we think licensure is pretty efficient in the state of Montana and didn't need it. Thank you.
Thank you. And also, Ms. Anderson, hang on just a second. I want to make sure, Mr. Longcake, did you have your hand raised and did I accidentally miss you?
Madam Chair, that's okay. I'm going to circle back here in a couple minutes, but thank you.
Thank you, Mr. Longcake. Ms. Anderson?
Hi, Madam Chair. Speaking to the compact issue as someone who's sort of advocated on behalf of a variety of compacts from the employer perspective, the thing I always want to think about is there might be 4 compacts in front of us, but if this is going to be a forward-thinking task force, what are our avenues administratively to address compacts as they develop for other licensures or certifications, so we don't hit a brick wall in 2 years in being able to participate in those compacts? I don't know if that makes sense, but I mean, I think emerging healthcare fields and employment and portability is so crucial for a state like Montana that I think we need to look at compacts as a smart recruitment piece, and also a smart way to train our young people so they know they have opportunities outside the state of Montana because of those portable licenses. So thank you.
Thank you, Ms. Anderson. Ms. Nearson.
I apologize if I'm jumping ahead, but I just, on behalf of EMS, they are certainly interested in exploring the EMS compact. And I just wanted to make available to the group if in the future we want to have somebody from the National EMS Compact do a quick presentation on the work that's already been done in the state and what it would take to get the state completely ready for the 2027 session to pursue that.
Excellent. Thank you, Ms. Nearson. Ms. Anderson, I think you might still have your hand up. Did you want to add anything else?
Nope, sorry, I forgot to lower my hand.
Mr. Longcake.
Yes, Madam Chair, thank you. I think having compacts as an opportunity or an option, I think is a very good option, especially in these smaller rural communities. And we're looking at stealing some of the topic ideas, some of the workforce shortages, and just being able to practice within the scope that these other entities have. When you're looking at retainment and recruiting, if you're coming from a state that allows you to do certain things and then you come to Montana and you're not able to do that, even though you've had the training and the expertise and the schooling, I think that's an opportunity that we could really look to see what kind of advantages we could maximize from those. And yes, not every compact is going to be transferable, but I think it's a great tool to at least have some discussions on and see what areas we can find and not have to recreate the wheel. If we can steal things that are working in other states and maximize those ideas and resources, I think it would be a good opportunity. So we're in support of looking at some of those compacts and figuring out ways to apply those standards to Montana.
Excellent. Thank you, Mr. Longcake. Anyone else have any comments on the portability and compacts, please?
Excellent. Let's move on. Oh, sorry, Ms. McCauley, go ahead.
Still on mute, Kristen.
Muted.
Thank you. I wonder if we could have the department do a little bit of looking at what the rules are from state to state about on that ability to what the rules are with practicing within the state, or if your resident travels to out of state, and what that looks like for like ability to treat in those across state lines the way it sits now, and if other states have any allowance for them to practice if they leave the state for any length of time that might allow increase in work short, and touch on that portability piece, Tina.
Thank you, Ms. Hensley.
Thank you, Madam Chair. Bouncing off of Ms. Anderson's comments, wanted to make sure too, and I don't know, it's impossible to make sure that compact staff on a national level is aware of everything we're doing in the state, but we do want to keep an eye on whether or not any of the reforms or changes that we suggest here on the ground would put us in danger of being included in the compact. I know that that's always a concern during the legislative session when we're touching licensure. Is this going to be okay with the compact in general? Again, just an asterisk of one thing we want to keep in mind as we're moving forward with these changes.
Excellent. Really appreciate everyone's comments on that. And just in the interest of time, let's talk about stackable credentials. Does anybody have any comments on the stackable credentials? Okay, thank you. Let's go ahead and move on to apprenticeships. Mr. King, since you had some interest in that, and can you please start us off with apprenticeships?
Yeah, and I know this was a hot topic, or one that we discussed at the Tuesday meeting. As going through the list, and I appreciate the asterisks there that are apprenticeshipable. Looking at the Board of Behavioral Health, I see candidate in there. Ms. Sullivan, is it fair to say that candidate would be similar to an apprenticeship? I just want to clarify that.
Thanks. I'm probably going to defer to Ms. Stallkamp on that, if that's okay.
Mr. Chair, with your permission.
Please.
Thank you. For the record, this is Jennifer Stallkamp. Candidate licenses in behavioral health land are for folks who have completed their education, but still need to complete a supervised work experience. So it is not exactly equivalent to an apprenticeship, but it is practicing under supervision for purposes of gaining the experience necessary to practice independently.
Yeah. With that, any opportunity that we can have to get these folks into the workforce, get them some education and training in hopes that they will remain there. We really need to take a hard look at what's doable, understanding that a lot of these require extensive education prior, and national certifications kind of weave into this too. So any opportunity, especially if they're not a doctorate or whatever level. I'm not picking on any other occupation here, but what can we do to get them into this field and keep them there? So I don't need to delve into that too much, Representative Etchart. So I'm open to other discussion on it.
Thank you, Mr. King. Anybody else have any comments on the apprenticeships? Okay, let's move on to Rural Health Transformation Program. And I think that a lot of us know about the RHTP. Montana got the 4th highest award in the nation at $233 million, thanks to all of the hard work of all of the members at the Department of Health and Human Services. Thank you very much, Director Brereton. We really appreciate that. That just goes to show that Montana is a healthcare desert. Also, in a recent study, we ranked #1 in healthcare deserts for EMS. So not only do we have rural health, but we also have many qualified frontier areas as well. And so what I want to do is this can be such a huge area of topic. And in the interest of time, we know that there's the Centers for Excellence with the Rural Health Transformation Fund, as well as the Rural Health Transformation Fund Task Force. So I really don't want to overlap here because of the 5 different frameworks that Department of Health and Human Services put forth in terms of Rural Health Transformation Fund, number 1 was workforce. And so that's something we're working on now. So again, I don't, in the interest of time, I think if we have anything new to say for Rural Health Transformation Fund as it contributes to this board and what we're working on now, do any of the members have anything that we can comment on, anything that we can also work in line with RHTP, please let us know. Ms. Anderson.
Madam Chair, one of my thoughts around some of the work we're doing around apprenticeships or stackable licensing and thinking that through is our partners in higher education and understanding that when we are talking about stackable licensure or apprenticeships, what is the pathway from an apprenticeship level employment profession into a higher education? Like I'm thinking, if someone does a certification at the local level with a different partner, an apprenticeship, and then they're interested in going into school to get a bachelor's in nursing or something, is there a way that that individual's experience and certification assists in their desire for their bachelor's? That's just an example. So I just want to make sure we're thinking about our educational partners.
Thank you so much. Director Brereton, thank you.
Yes, Madam Chair, thank you for your comments. I ultimately want to ensure that this subcommittee is acutely aware of Initiative 1, which is related to workforce in the Rural Health Transformation Plan, as well as some of the associated sub-initiatives. And so what I would propose is that we carve out maybe 15 to 30 minutes during our next subcommittee meeting just to socialize that initiative and those sub-initiatives for this group due to the absolute overlap, especially when we consider some of the metrics as well related to workforce that the state of Montana committed to.
Director Brereton, that is an excellent idea. I really appreciate that. And also, if at this meeting you want to talk about that more, happy to discuss that at this meeting as well to make sure that we're going on the same trajectory, because you are in an excellent viewpoint to be able to get us all on the same track so we're in the same lane, streamlining all of our work in this to make one united goal. So if you have anything extra you want to say about that, or for this meeting, or you want to save it to the next carve out, what would you prefer?
Yeah, thanks again, Madam Chair. Let's revisit during our next meeting. And I think as everyone on this call knows, Department of Labor and Industry is our partner for Initiative 1, for implementing Initiative 1 in the RHTP plan. So it could look like a joint DPHHS DLI presentation. So give us some time to coordinate with DLI, and we'll of course work with Aaron too to ensure that there's some time on the agenda at our next meeting.
Excellent, Director Brereton. I really appreciate that. Did you have any other comments or anything you wanted to make? We hadn't heard from you yet. I'm glad to hear from you this morning.
Not at this time, Madam Chair. Thank you.
Thank you. Mr. Brown?
Thanks, Madam Chair. Webb Brown, Montana Dental Association again. Director Brereton didn't mention and should the extreme timeline that the RHTP program has as well to spend money in the first quarter. And so I'm not too sure we shouldn't throw another meeting in there before the next meeting. It would be up to him. And again, as Representative Butchery says, adding more work to DLI. But I think there's a real time crunch here. And I think that's, again, where the focus really should be for not only RHTP, but also probably this task force, although, again, it's somewhat outside licensing. Thank you.
Thank you so much. Looks like no other hands raised. Let's go ahead and move to telehealth. As we all know, CMS is also working on some different guidelines for telehealth. It's been up and down with what they're allowing for billing over the last several years. Of course, it opened up during COVID, and then different rulings on that. So Montana, of course, just what we talked about last with the healthcare deserts, frontier, and rural medicine. So comments from the committee, please.
Madam Chair, will you please repeat that?
Thank you so much, Ms. Henley. I was just talking about telehealth and how it can impact Montana. And I really, to, I guess, restate better, I think telehealth in Montana, when somebody has to travel to Billings for healthcare, even Great Falls for healthcare, to see a specialist, and they're traveling all the way from the far corners of our state, from Havre, from Sydney. I mean, not all of the times does the wonderful small airfare or I won't use their name here, but we have some airlines that can bring us to care, but the importance of telehealth for people that can't get on an airline, that can't travel, all those kinds of things. Miss McCauley?
On the telehealth standpoint, I think that I work largely in that realm, and it seems pretty reimbursable. It's well received. The major barrier that I see in the very impoverished and the a large group is access to working phones, connectivity, and so the barrier there seems to be internet service, phone access. But I think that there's funds here through the RHTP, which is the other topic, but that there are stethoscope telehealth things, and there might be a way to use tools that would help that in the telehealth discussion.
Thank Ms. McCauley. Ms. Anderson.
Thanks again, Madam Chair. So telehealth for Montana's federally qualified health centers is anywhere from 10 to 15% of the services we provide, largely behavioral health, but not limited to that. And there's certainly some federal issues that I don't know if, as a state, we can think about working with our federal delegation. We just got our telehealth flexibilities renewed through 2027. It would be great if that was a permanent fix. We also don't have telehealth parity, payment parity on the Medicare side. We do, I believe, on the Medicaid side. And then certainly with our private payers, telehealth tends to pay less, but our infrastructure is still the same. So it doesn't necessarily have to do with the licensing piece, but it does determine whether some licenses are sustainable. And so critical component and how we connect the dots between sustainability and these licenses is important for the telehealth piece.
Excellent. Really appreciate those comments. So I'm going to go ahead and just move on here to continuing education. And I think what we've already talked about with continuing education is aligning national certifications with what we're working on at the state. And again, in the interest of time, unless anybody wants anything to add with that, that's something that we've kind of already addressed with making sure that state licensing aligns with national licensing wherever applicable. Would anyone like to add anything to that?
Madam Chair, this is Gail Tronstead. I am curious who determines how much of the continuing education can be online or must it be in person? How is that determined for various professions?
Ms. Tronstead, to answer that question, I think there are all kinds of different continuing education credits that are allowed. And if the person providing the continuing medical education credit has that certification, it doesn't matter whether it's in person or online. If they received approval to
Hi, Matt.
give,
Hey, Madison. Let me mute this other meeting I'm in.
if they I'm sorry, if they are credentialed and that's approved through their credentialing body, it doesn't matter if it's in person or online. Does that help with your question there?
Yes, thank you.
Certainly. So would anybody else want to add anything with continuing education, or can we move on? Okay, so let's move on to scope of practice. So Mr. King had some comments earlier on scope of practice, and certainly we don't want to get into those topics necessarily here, but I also think that with the Rural Health Transformation Fund and the initiatives at both the federal level and the state level, that one of the things that the governor has said about before is that we want to make sure that everyone practices to the extent of their education and training, which is not a scope issue. If you're practicing to the extent of your education and training, you are practicing within your scope. So I think it's important that, as Mr. King stated earlier, that we keep our comments to allowing our practitioners in the state of Montana to practice to the extent of their education and training, which may involve changing some of the licensure requirements or some of the holdback on those licensures. So I'd like to open that up to that discussion at this time. Okay, no hands are raised. Let's go ahead and move on to workforce shortages. Okay, thank you, everyone. So what I want to do too is Commissioner Swanson had talked about some different things that we haven't discussed on our issues here. At the workforce meeting on Tuesday, she talked about red tape removal and operational improvements. And yes, that goes under administrative burdens, but I also think that with our administrative burdens, we didn't really open that up as much as we could have. So I want the committee to think about red tape and operational improvements that we can make. Any comments there, please? Mr. Longcake.
Madam Chair, yeah, I just wanted to throw out an example. I have of one of the individual groups that I'm working with that is responsible for mortuary services, and they're required to have several licenses that I think could be reviewed and looked at. For example, if you're a licensed mortician, you also then have to register your mortuary. You also then have to register as a crematory specialist, and then you also have to register and license your crematory services facility. So I think as a licensed mortician, based on their education and training and services, as you described, for their kind of scope within their education, I think this is an area where we could streamline and maybe find some efficiencies related back to that red tape initiative and try to find that process a little easier and simpler for those individuals that are working in this specific profession.
Thank you. Ms. Anderson.
Thank you again, Madam Chair. An issue was raised with me a week or two ago that I have not had time to research, but it has to do with the fact that some of our independent practitioners, so our MDs, our advanced practice registered nurses, our PAs, they live in different parts of code. They live in different, licensing boards, but some of them have different language in the administrative rules that gives them some guidance, particularly around medical assistance. And so I think we need to maybe compare those administrative rules to make sure our independent nurse practitioners have some of the same oversight and supervisory authorities for MAs that PAs and MDs have. So I'm sure there's other licenses that have some of that discrepancy because similarly situated licenses are in different boards, and we've maybe missed the boat in some of the rules.
So, Ms. Anderson, just to ask you a question in there, as I was looking through the licensing health task force, I didn't see CNAs on here, and so I was wondering. So, are you talking about MAs, CNAs specifically? Can you expound on that a little bit? Because I do think that that's very important. Because if you're going to be an APRN and open your own business, which is going to increase access to healthcare, especially in our rural areas, you need to be able to supervise staff to adequately care for your patients. Can you expound on that a little bit, please?
So my understanding, and certainly DLI staff could go down the rabbit hole faster than I could to figure out what the problem is, but under the Board of Medical Examiners, there's specific language that MDs and PAs specifically have, because they're all licensed under the Board of Medical Examiners, is that MAs, medical assistants, they can supervise them and delegate certain tasks to them. There is no similar language under where APRNs are licensed, which I suspect is the Board of Nursing, where Board of Nursing APRNs do not have similar delegation authorities for MAs. So I have a clinic that, because of a retirement and a maternity leave, their clinic is now going to be run for an NP for a short amount of time, and now they don't know how to handle their MAs. And that is a real problem. So it's primary care clinic. And so those are some of the things I want us to think through in this task force, like these little fixes that could be really meaningful for primary care clinics, which is who I work with.
Excellent. I appreciate that. Ms. Hensley.
Thank you, Madam Chair. I am going to ask us to briefly pop back to workforce shortages, just so I can get this out. I mentioned at the top that I acknowledge that not every solution or deep dive is under our eventual purview. However, I know that many of our workforce shortages are directly due to money type problems. So specifically occupational therapy, speech language pathology, physical therapy, they're not being compensated enough for this state. They haven't had a decent raise in way too long. And as a result, people that were training here in the state, with that brain bleed is happening to other states. Additionally, as I said at the top, insurance credentialing is an enormous hurdle and sometimes can be 4 to 6 months, where small tweaks in the language, maybe not in Title 37, but in another section, including any willing provider, would really help things move along out in the field. So I did want to raise those issues one more time to acknowledge for the workforce shortages. There could be some dovetailing there with the RHTP and other policy initiatives.
Excellent. Appreciate that very much. And then, of course, again, limiting to members of the board right now. So we're not ignoring members of the public, but let's go ahead. I don't see any other hands raised. So let's talk about one of the other things that's not on here that I think is really important. The Department of Labor and Industry made this fancy licensing healthcare task force list of all of the different boards we have in Montana. And you see that we have a lot of different boards in Montana. So each and every one of those are listed. If members of the committee, if you can take a peek at that right now, if you were able to print it or even just look at the documents that Ms. Sullivan sent us earlier, that a lot of different boards. And then we also have the number of licensees on each board. So one of the things to keep in mind, and I'm just going to start off this discussion, is the burden on the Department of Labor and Industry to staff each and every one of these boards. And some of these boards don't have a lot of people on them. So one of the things I think that we can look at here, well, of course, continuing with our scope of making sure that we are providing safe care to the public, I'd like to open it up for the committee now to discuss the possibility of board compensations. Board composition, and if there's any opportunities there to reduce red tape and to reduce costs. Ms. Hensley.
Thank you. Just wanted to mention under this specific type, this is a conversation that I had a lot last session for several different boards. So I just wanted to pass on things that I learned. And I feel like it's critically important that regardless of the redundant nature that many boards seem to exhibit as far as membership, when it comes to things like discipline, and I know that we're going to be getting a presentation on the disciplinary process, et cetera, but when it comes to discipline or an non-traditional way of licensure, path to licensure, it's critically important that peers are able to review peers when it comes to their specialty and their expertise. That we don't have, for example, an audiologist responsible for deciding whether or not an occupational therapist performed within the scope of their profession. And so I just wanted to put that out there preemptively, that it's not redundancy, it's not unnecessarily burdensome. It's critically necessary that we go slow on these things and have those peers to review one another. Whether that means they're sitting on the board or not is not my call. I prefer them to be sitting on the board because of the statutory requirement to include them in the decision. But I did just want to point that out and elevate the topic.
Thank you, Ms. Hensley. Representative Buttry, please.
Thank you, Madam Chair. I think that there's an opportunity, and I've talked about this with the department, with the commissioner, but are there areas where we could create endorsements, meaning that we could take some of perhaps license boards where there's not a lot of licensees and put those disciplines as endorsements under an existing licensing board? So in essence, we would end up at the end of the day with fewer licensing boards and more licenses that would be achieved through endorsement. Maybe Ms. Sullivan could speak more to that, but I have had conversations with Commissioner Swanson on it. Do we really need to go through all the licensing activity for some of these disciplines where they could be endorsements, which is a much easier sort of rank to achieve, and reduce licensing board and increase endorsements? Thank you.
Thank you, Representative Buttry. Really appreciate that. Ms. Nearson, did you have a comment?
I considered having a comment, but then I decided not to.
Excellent, thank you. Any other comments on the board composition, or for that matter, I don't see any hands raised from members of the committee. Any of the member topic ideas that we've discussed? Mr. Longcake, go for it.
Yes, Madam Chair, I've had a chance to look at some of these different boards, and I appreciate everybody for sending out that information to the group. My question is, on some of these boards, it looks like there's a discrepancy in terms of the numbers of individuals that are on there that are representing the specific licensees, and maybe having an evaluation of that to see that there's equal representation across the board for those individuals that are being monitored and supervised by the board might be something to at least note and look into.
Thank you, Mr. Longcake. I really appreciate that. So I think that we have made it through that, so that's excellent. So what I would like to do now is, Ms. Sullivan, I want to turn this over to you and have you discuss with the members of the committee to outline the plan to address these topics that we just discussed. And then also, if you could consider at our next meeting dates, we have our next meeting already for March 13th. Are we just going to go ahead and do that 1 month at a time in advance, or are you having some proposed plan for, say, a couple meetings in advance? If you could address those, please.
Sure. Thank you, Representative Etchart. So I tried to take as many notes as I could. It sounds like you guys kind of want to tackle a little bit of everything, but the big groups of, I guess, topic ideas that I at least identified was the administrative burdens that can go, there's a lot that can go under that. Like I had said, licensing costs, background checks, any kind of barriers that were for unlicensed or people that whose license was not accepted. So what happened there, looking at some of that kind of stuff, and then also the red tape. And I think as far as administrative burdens, we could roll in the board composition and board structure into that because as Chair Etchart said, it can be an administrative burden for the department with limited FTE in trying to administer and staff all of the boards. And so that it could be considered under that topic, or if you guys want to look at that as its own topic, that's fine too. But the administrative burdens and then the portability and compacts, that conversation, I think, kind of plays in with telehealth, workforce shortages, and all of that. I think that could be another main topic that can be addressed. And then I don't know if I really missed anything else. Like, those seem like they're kind of like the two big ones that we could possibly, look at smaller things within each one. So what I do want everyone to keep in mind is if you look on page 2 and just page 2 of the worksheet that I provided is all of the different initiatives within the executive order. And I already kind of went through and pre-filled a little bit of it, but we just want to confirm with the subcommittee that throughout all of your work, you are going to keep these initiatives in mind and focus on the ones that make sense to the healthcare subcommittee. And so what I had put on there that can be considered during this process is if licensure significantly increases the cost of service to the public, if the scope of practice is readily identifiable and distinguishable from other professions and occupations, because there are so many healthcare occupations. And so kind of talking about that scope of practice a little bit. If the next one is about the occupation or profession requires specialized skill or training with nationally recognized standards, that one that was discussed, and so that should be addressed. If qualifications for licensure are justified, I think that an endorsement conversation can be rolled into this, as well as if the license is necessary to be an actual license, or if it could be an endorsement, and if it is a license or an endorsement, like if the qualifications that are already set are all absolutely needed, or if there's some that maybe aren't necessarily relevant anymore. The good moral character is one that a lot of license types look at as kind of being an outdated requirement, because you can get anybody to say that you're a great person, right? And then unnecessary barriers to entry for applicants, and whether existing licensing requirements contribute to workforce shortages or are constraints in rural frontier communities. Again, the portability, reciprocity, endorsement pathways, if there could be expansions to those. And then if the licensing structures are aligned with state and the state and federal rural health transformation initiatives. So those are really the ones that I thought would be good. There, I left a couple blank because I wasn't sure if the committee would want to tackle the 3 blank ones. So just consider those. You don't have to make any decisions right now. You don't have to commit to any of these, but we do need to address all of this in our final report. So as far as prioritizing things, I think the easiest thing for us to look at first are administrative burdens. And so I would maybe start focusing on that. And then the next item would be the portability piece to it.
Excellent, Ms. Sullivan. I like that a lot, because as I'm looking at this, we have 6 meetings scheduled coming up. And so what I think we really need to do is we need to decide which we're going to tackle at each meeting. And I think one of the first things we need to tackle is absolutely administrative burdens, because that takes over so many different things that can also administrative burdens in the board composition can really work into that. So what I want the committee to really consider going forward is that's going to help a lot with public comment today too. So at our next meeting, members of the committee, if you can please let's do administrative burdens. And so that's what we're going to talk about at our March 13th meeting. So that's where I want to focus our next few minutes as we go forward and move into public comment, because public comment is so important. And I want to make sure that everybody that's on, and again, we have almost 200 people on, if we can limit this right now, of course, it's not limited, but if we can, so that everything is heard in a manner to make sure that all voices in Montana are important, is let's talk about administrative burdens. And one bullet point I would like to see under there is board compensation that we're going to discuss at our March 13th meeting. And I'd love it if our members of the committee would please weigh in with that in terms of, we're going to talk about administrative burdens on our March 13th meeting. And I'd like to see board composition in that, just because that's such a big topic also. So members of the committee, looking forward to what you have to say about that and the bullet points that you want under administrative burdens for the next meeting. Representative Buttrey.
Yeah, thank you, Madam Chair. And I hadn't heard Ms. Sullivan discuss this when she was talking admin burden, but I do want to look, as I said in my initial comments, at what can be automated for those that are hiring and employing the licensees, so we could reduce their administrative burden.
Ms. Sullivan, did you catch that?
I did, yes.
Thank you.
Perfect. Okay, Ms. Sullivan can kind of get a list maybe together by next week of different bullet points to go there that she can send out to the committee so that we can start working on that and start preparing to make sure that we're adequately prepared for that. So given that, members of the committee, anything else that you'd like to discuss that we may have overlooked this morning? Representative Buttrey, do you have your hand up?
Oh, sorry, I'll take it down.
No worries, sir. I want to make sure that we hear your voice. So just giving you some grief there, Representative Buttrey. Okay, so what we're going to do now is we are going to move on to public comment. So I think we'll probably have a lot of people for public comment. So a couple things that public comment needs to remember here is, in the interest of time, everybody's comments are very important. You can also provide written comments, but for the record, we need you to state and spell your last name. Also, there will be no disparaging comments allowed. If anyone is making any disparaging comments toward any member of the committee, any elected official, or a member of the executive branch, you will instantly be muted. And so keep your comments respectful. And also, I'm going to have to limit comment to 60 seconds per person, because I think we have so many people on. If it turns out that a lot of these people choose not to comment, we can open it up further. But given that, thank you so much, and I look forward to respectful conversation going forward in public comment. So let's open it up. And if someone's a doctor and your name is not on there and I don't call you doctor by the appropriate title, I apologize in advance. But Ms. Herndon.
Thank you. My name is Dr. Emily Herndon, EMILYHERNDON. I'm a physical therapist in the American Physical Therapy Association chapter president of Montana and a small business owner of Plains Physical Therapy in Sanders County. Thank you, Madam Chair, and the members of the subcommittee. I want to focus on one barrier that is not about public safety, but absolutely affects employment access and the care in Montana. It's commercial insurance credentialing delays. When a healthcare provider receives a Montana license, that state has already verified their education, their examination, and their qualifications, and they're legally able to practice. But in reality, they often cannot work. We routinely see both commercial insurance and Montana Medicaid credentialing delays of 90 to 180 days, sometimes even longer. During that time, a newly licensed provider may not be able to start the job. A rural clinic cannot bill for provider services. A small business carries payroll risk and delayed hiring, and patients wait for longer care. This delay can mean losing a job candidate to another state, delaying clinic expansions, leaving a community with limited access to therapy services, and this delay is administrative. It's not about safety. Other states have recognized this problem and acted. Colorado requires insurances to complete credentialing within 60 days and allows enforcement when they fail to comply. Washington State requires decisions within 90 days and uses a centralized electronic credentialing system. Texas and New Jersey have 90-day deadlines in their state policies. If we want to grow Montana's healthcare workforce, especially in the rural communities, we need to remove delays that keep licensed professionals from serving patients. Thank you.
Thank you so much, Dr. Herndon. Ms. Thomas.
Yes, thank you. This is Kayla Thomas, Kayla Thomas. I am a community health worker with Providence in Polson. I just wanted to first thank you for the opportunity and just make a comment on in the last legislative session, there was a bill put forth, shout out to Ed Buttrey for that, to try to license community health workers, and it made it most of the way and then ended up getting vetoed at the governor's desk. And so I just want to bring that forth and use this as an opportunity to advocate for community health worker licensure, especially since this subcommittee is about healthcare and licensing. I just felt it relevant in this space. Thank you for your time, and I'm done.
Thank you, Ms. Thomas. Appreciate that. Ms. Voller.
Sorry about that. Thank you very much. Yes, my name is Alyssa, Alissa. Last name is Voller, V as in Victor, Oeller. I am currently a student at Carroll College, completing my last semester and receiving my master's in clinical social work. I want to thank you guys. I deeply appreciate the work you're doing here. I can see, Mrs. Sullivan, all the work you're putting into this, and it's amazing, and I thank you guys. I just want to talk first off about the administrative portion of what you guys mentioned. In our profession, we are guided by the Administrative Rule Montana to include Title 37 of Montana Code Annotated. I would be remiss if I didn't mention that it is really important for us that we as social workers get the opportunity to receive direct input for any changes or reviews made of the Title 37 Montana Code Annotated. With regard to portability, as you guys have already mentioned and is well known, the social work compact was denied. Not denied, it just didn't get passed. So
10 seconds left.
Thank you very much. I just want to mention that we would like included and not forgot about when it comes to the portability in the social work compact. And finally, I don't want to belabor the topic. We already mentioned it earlier, but we are okay with streamlining administrative processes. We really don't want the clinical safeguards to be brought down. So if you guys could just consider that when you're moving forward with your task force, I would deeply appreciate it. Thank you.
Thank you, Ms. Voller. Lieutenant Commander Noel.
Wow, I'm James, JamesNowell, private business owner, Extra Mile Psychiatry in Montana. It's a telehealth type of business right now for mental health. The 60 seconds kind of got me a while ago, so let me just narrow my focus for one thing. To improve what the administration burden was mentioned and the cost and the red tape. I think as a student coming through an online program, I was limited to who would take me as a student. And therefore, I ask that we propose an incentive that would possibly be for all practitioners throughout the state, an incentive for them to accept a student that's online. We know we have support from universities. They can get their people everywhere, but bringing a spouse, a military person into our state, that spouse right off the bat has a disparity on who they can get to sign their papers as a practitioner student. So I think the task force with this maybe propose a military
10 seconds
liaison,
left.
a military liaison person, and also cutting the red tape and giving incentives for practitioners to accept a student. There was a lot of opportunity in Flathead County that I did not get because practitioners had no incentive to take a student, and therefore the big hospitals only took medical students instead of nurse practitioner students for mental health, and that was a disparity within my online course. Thank you.
Thank you, sir. Ms. Wangan.
Hi, my name is Marty Wangen, Wangen, and I have comments for the Montana Optometric Association, the Montana Psychological Association, and the Montana Podiatric Medical Association. For the optometrists, they find their board to be very efficient and are looking for no change. For the Board of Psychology, we would like to thank the department. We had a problem with delayed board appointments. And as everyone on this call would know, that affects the public and stakeholders who rely on timely decisions. That was remedied, and we do now have a seated board. And for the podiatrists, I spoke with some of them, and they report that the licensing process is quick and easy, and they would also like to see no changes. Thank you.
Thank you very much. Miss Kugler-Oman.
Yes, hi. My name is Shauna Kugler-Oman. I'm a currently practicing dental hygienist in Kalispell, Montana, and also the current president for the Montana Dental Hygienist Association. I just wanted to state how thankful I am today to be able to be a part of this, and how the Dental Hygienist Association is thankful to be a part of this. And we're just interested in discussing portability, compact workforce shortages, the scope of practice, and equal representation on any of the governing boards there. So just want to thank you again for the opportunity to be able to be a part of this, and looking forward to working with everyone. Thank you.
Thank you very much. I apologize. I don't know if it's a Mr. or Mrs. Evans next. Ainsley Evans. You're on mute.
Hey, how you doing, beautiful people? I'm Inslee Evans, been a clinical laboratory scientist out of the United States Army. I've been a national science. I've been to over 150 plus hospitals in 45 states. I came to Montana in 2020 for an emergency to assist a variety of hospitals that needed help. I saw a lot of things that shouldn't have taken place. So one thing I do want to talk about is accountability. We can't have leadership in place demanding that staff do things that are against the one law as well as the profession that we hold. So we have to hold hospitals also accountable for those particular things, especially when it comes to individuals like myself, who is also an independent contractor. So if I don't get compensated from the hospital, we have to have a liaison in place for contractors like myself, who's also incorporated in Montana, to make sure we have coverage for ourselves when hospitals breach their contracts. Another thing that I want to address is to assist the whole state of Montana. I presented a national 24-hour childcare to assist staff, especially in rural areas, with 24-hour childcare. Because the main issue is not having childcare, not having affordable childcare, and not having
10 seconds left.
Sure, and not having parents have to worry about their well-being or their child's well-being while they're trying to perform their duties. So I do agree that we do need to have some changes and more accountability. Thank you. Thank you, Madam Chair.
Thank you so much, Mr. Evans. Appreciate that. Ann Joseph.
Hi, my name is Ann Joseph, Joseph. I am a licensed marriage and family therapist and behavioral health director at an urban Indian health center. There's a cultural phenomenon in Montana that does not exist in other states, which is the idea that master's or doctoral level licensed mental health providers need to be duly licensed as an addictions counselor to provide substance use disorder treatment. It is entirely within the scope of practice for an LMFT, LCSW, LCPC, or clinical psychologists to treat substance use disorders, though many feel the need to become duly licensed as an LAC due to employer requirements or requests of referring providers such as the courts. This idea that being duly licensed is necessary creates administrative barriers to treating an incredibly underserved population in the state, those living with substance use disorders. It also means that mental health professionals who are generally underpaid in the state take on the financial burden to renew both licensees annually and pay for double the amount of continued education, as you can't count your LCSW CEs for your LAC CEs and vice versa. I'm wondering how this committee and the board can reduce barriers to essential SUD treatment and help change the culture in Montana that one needs to have a less advanced licensure, such as an LAC, in addition to your current licensure, LCSW, LCPC, in order to treat substance use, which was already in your scope of practice. So overall, again, the culture around
10
this in
seconds
Montana
left.
creates a barrier to treatment, and I hope this committee can help create a change. Thank you.
Thank you so much, Ms. Joseph. Appreciate that. Flor Lopez.
Hi, my name is Flor Lopez. I am a licensed master social worker, so I don't have my clinical license. My name is spelled Florlopez. I was recently a healthcare social worker. However, with the changes with Intermountain Health in Montana, they are going off of some other states' requirements as such as Utah and Colorado, saying myself and others as a LMSW was we need to go back to get our clinical licensure. However, a position in the hospital is not behavioral health, it's care management. So more social work rather than the clinical license needed. My question is, how to address the healthcare need for social work, not necessarily having a clinical social worker doing social work, but two separate scopes, if that makes any sense. I'm more than qualified to do the care management. However, with some of the other states, they're saying I need my clinical license, which we're not able to get in the hospital since it's not a clinical setting to do family therapy, individual therapy, and group therapy. And yet they're still signing off on licenses to do that, which I feel is unethical. Thanks.
Thank you, Ms. Lopez. Mr. Clapp.
Yes, thank you all. My name is Walter Clapp, WalterClapp. I'm an attorney officed out of Red Lodge, and I represent entrepreneurs. I think the lifeblood of our capitalist society and the governor's agenda here. I think the problem that I see is looking at entrenchment of competitors on boards overseeing licensure, but more importantly, discipline. The U.S. Supreme Court has a recent decision in SEC v. Jarsky. I recommend everyone go familiarize themselves with that. I think when you look at that in conjunction with the Montana Supreme Court's recent decision regarding the discipline of our Attorney General Knudsen, the due process concerns are being litigated and should be taken into consideration as you move forward. I would love to speak with each of you, Ms. Stolkamp, particularly in the chairs. I think that the Seventh Amendment of the U.S. Constitution and Article 2, Section 26 of the Montana Constitution requires it. And again, appreciate the governor putting this together and all of you coming together to fight the good fight. Thanks.
Thank you, Mr. Clapp. Appreciate that. Valentini Amanda, I can't see your full name there. Sorry about that. Go ahead, Valentini Amanda. Again, I'm sorry I can't see your full name, but we can't hear you. So I'm going to go ahead and move on to Dr. Pepper, Valentini, Amanda. If you want to go ahead and mute yourself, we'll come back to you in just a minute and we'll keep trying and we'll make sure we get your comments in. But Dr. Pepper.
Good afternoon. My name is Shantae Pepper, SHANTI-PEPPER, and I'm a licensed psychologist residing in Bozeman, Montana. First of all, I appreciate the work of the task force and the complexity of the issues involved and the number of boards you all are dealing with. So just want to express my gratitude for that. I also want to emphasize the importance of ensuring clear and meaningful representation from all relevant boards, including, of course, the Board of Psychology and the Board of Behavioral Health. And just given that any structural changes may significantly impact licensure standards, scope of practice, and ethics oversight, each profession should have direct and substantive input in these discussions. And additionally, if boards are consolidated and representation should not be based solely on the number of licensees within the state, right? So smaller professions or smaller boards should have a meaningful voice. So just equal professional representation is essential to ensure the standards of licensure, scope of practice, and disciplinary review, making sure those are determined by those who hold the relevant credentials and understanding those distinct training and ethical frameworks from each of those disciplines. So thank you again for this consideration and the time to speak. I appreciate that. Have a great day.
Thank you, Dr. Pepper. Valentini, Amanda, we're going to try to go to you again. You're on mute. Okay, Valentini, Amanda, we'll come back to you in just a minute. Miss Kimmett?
Yes, hi, and my name is Deborah Kimmett, Deborah, last name Kimmett, Kimmet, and I represent the Business League for Massage Therapy and Bodywork. And we have this sneaking suspicion under the board composition, or what I call board consolidation issue, that our board might be slated for some consolidation. And last interim, we expressed an interest or expressed that we were not opposed to consolidation. We were more concerned about which board we would end up with. And we do believe, and I also spoke with the chair of the local board, and she can't speak for the board, but for the state massage therapy board, but she's in agreement with us personally, which is that we believe that the alternative healthcare board might be a good place for us to be consolidated, because we should be consolidated with another healthcare profession. The other piece is that regarding the creating endorsements, et cetera, is that our concern about that is that it could affect the compacts that any profession might join, because it would potentially jeopardize their ability to be in a licensure compact. So just wanted to make those two quick points, and thank you guys. Thank all of you for all your hard work.
Thank you. We appreciate that. Let's go to Kay Goodwin.
Good afternoon. Almost. Yes, it is. Good afternoon. This is Kirsten Godwin, and my name is spelled Kirsten. Last name is Godwin. And I just want to thank you, Madam Chair, and members of this task force. I am a registered dietitian nutritionist, but I'm also senior manager of 3 different areas for Providence Medical Group and Providence Health and Services here in Missoula, Montana. The first area that I want to speak to is I oversee our Providence Medical Group pediatric clinic, as well as our endocrinology clinic. So I have several physicians, nurse practitioners, physician assistants, nurses, MAs, registered dietitians, and diabetes care and education specialists that report to me. And compact licensure, as well as telemedicine, is something that I just want to make sure that it sounds like we're addressing, that you're all addressing, that does not get minimized. It is such a vital need. Being here on this side of the state in Missoula, We get a lot of patients from Idaho that do not have access to our specialists. I have one endocrinologist for this part of the state. There's 2 others in Kalispell. It is a
10
huge
seconds.
need. And so I just want to make sure that we recognize that and make sure that that compact stays there, as well as registered dietitians, also safeguarding their clinical licensure for their compact that they are involved in as well. Super important for rural health.
Thank you so much. We appreciate that. Randy?
Thank you.
Good afternoon. My name is Randy McHenry, last name McHenry. I'm a licensed denturist provider in the state of Montana. I am also the president of the National Denture Association for the US. I want to speak about my profession as denturist. For decades, denturists have faced regulatory restrictions that do not reflect our education, training, and competency, thus limiting our ability to expand scope in ways that is supported by modern education and standards. This is a clear objective to the extent of what the governor wants with this task force. So we do have a lot of issues going on, and I think this task force can adequately address a lot of them. I want to bring up a quick point that Brad Longcake brought up earlier. Denturists have no representation as a licensed group under this task force, and I would love to see that. And again, thanks everybody for all your time and effort into this. I know it's going to be a lot. So thank you, Madam Chair.
Thank you so much, Mr. McHenry. Ms. Bushmaker?
Hi, my name is Kara Bushmaker, Bushmaker. Thank you to the Licensing Reform Task Force for all the work that you guys have put in. I'm a current board member for the American Society for Clinical Laboratory Science in Montana, and I'm also a past clinical laboratory practitioner licensing board member. That state licensing board has recently been restructured through several rounds, including the Red Tape Initiative is included in the Board of Allied Health Professionals. We do not see any concern with licensure for medical laboratory scientists or technicians as it is in the state of Montana right now. Instead, we'd like to help shine light on actual barriers to laboratory staff recruitment and retention at the certification level, state education support, increased wages, and training opportunities in the state of Montana. And I appreciate y'all's time today. Thank you.
Thank you so much, Ms. Bushmaker. Ms. Schmidt? Ms. Schmidt, you're muted.
Dear Madam Chair, Representative Eckhart, members of the committee and task force, thank you so much for your important work on this task force, and I really appreciate it. My name is Sam Schmidt, SAMSCHMIDT. I'm a physical therapist and I represent APTA Montana as well as a private practice owner. I want to express my support for the efforts in streamlining credentialing as that has expressed delays care and folks that we employ into our small businesses. I also further want to encourage this group to consider the growing presence of virtual healthcare providers and AI-based platforms. It is important that Montanans clearly understand whether they are receiving care from a licensed provider. One potential safeguard could be requiring disclosure of an NPI number or a state license number to patients prior to these virtual treatments. Appreciate the opportunity to raise this issue for your consideration, and thank you for all your hard work.
Thank you, Ms. Schmidt. Ms. Ross?
Hello, thank you for the opportunity to speak. I am just coming as a citizen. A couple of things to think about. I want to reiterate some of what Board Member McCauley mentioned as far as telehealth goes, and when somebody is traveling out of state, the barriers to care that creates when a provider cannot provide care to somebody. There are a lot of families, especially in the construction industry, that travel for contracts to out-of-state licenses, but they don't change their residency. They don't establish residency in the new state. But if their children are in things like speech pathology or other therapies, then they're not able to continue to provide care. And so the children lose out on some of that essential care that can happen in those early childhood years to make a big difference in their lifetime outcomes. It's really difficult to establish care for people when they're out of state. There's oftentimes wait lists and issues with that. So I really appreciate that it being mentioned. And then the other thing is just on the board composure. It is really important, and a few people have said that so far, that before we make any recommendations for changes to the composition of the boards,
10
that the
seconds.
actual experts in those fields are the ones educating the board on what that means, because there are so many nuances in every field that need to be considered. Thank you.
Thank you, Ms. Ross. Drew Duncan.
Yes, Madam Chair, members of the committee, thank you for your time today. Drew Duncan, DRUE, DUNCAN. I am in government relations for Pfizer, wanting to address a regulation within the Board of Pharmacy that is not unique to Montana. Currently, we are given, the regulations say we have to give the state notice 30 days prior to closing on an acquisition. And we're immediately out of compliance because and the entire industry doesn't know until the FTC tells us when our acquisition will close. So just a small change would be needed to move from prior to within. That would be ideal. Darren Nathan is also on the call and may want to add as well.
Thank you, Mr. Duncan. James Wright.
Oh, one more thing, and I'm happy to supply language as well.
Thank you, Mr. Duncan. James Wright.
Hi, I'm an integrated body worker or alternative modalities from massage worker. I've been doing it for quite a few years. And there is a problem with the alternative modality societies such as Traeger work, Feldenkrais, Upledger, Polarity, orthobionomy, phased release. And it's a part of the health society that is looked down upon, but these modalities are required to get at least a massage license to be able to perform their work. Specifically here in Montana, many people have been driven out of the state that do this kind of work. And there's litigation in other states for this kind of work. I would like to hear more about this with the committee, and maybe we can do something about people being able to practice this work and help people in an adequate situation where we don't have to get a license in another profession. And I would just like the committee to consider that and hear more about it with the committee. Thank you.
Thank you, Mr. Wright. Ms. Kelly.
Good afternoon. My name is Darcie Kelly, DARCIE I'm a licensed clinical social worker in private practice, and I serve as the Legislative Committee Chair for NASW Montana. We have 550 members in NASW, the National Association of Social Workers in Montana, and nearly 2,500 licensed social workers in Montana. We appreciate the focus on removing unnecessary barriers while protecting public safety. Licensed social workers support smart modernization of licensing systems, especially when it improves workforce mobility and rural access. Behavioral health is a critical part of Montana's healthcare system. Licensed social workers serve in hospitals, schools, private practice, corrections, and community settings across the state. Any discussion of healthcare licensing must intentionally include behavioral health. We strongly support adoption of the Social Work Interstate Compact. It increases portability and workforce access without lowering education, supervision, or examination standards. It also strengthens public protection through coordinated discipline across member
10
states.
seconds.
At the same time, we want to emphasize that clinical education, supervised experience, and clear scope of practice standards are core public safety protections in behavioral health. Streamlining administrative processes makes sense. Weakening clinical safeguards does not. We respectfully request that social work licensure be included in ongoing healthcare subcommittee discussions and that social work interstate compact be identified as a priority. Thank you.
Thank you, Ms. Kelly. Ms. Sullivan, are there any more hands raised?
Madam Chair, I do not see any more hands raised.
First of all, I just want to say thank you for all of the public comment. It was very respectful. It was also very helpful. I appreciate it very much. You made excellent comments that the committee can work on going forward. And if you felt like you had more things to say, please submit your comment via written testimony. And I do see Dr. Davis. Please go ahead, Dr. Davis.
Hey, I'm Dr. Austin Davis. I represent the Montana Chiropractic Council. We appreciate, Madam Chair and the committee and everything you guys are doing. We did have some concern to be brought up about licensure for chiropractic moving forward after the last legislative session with HB 500 and HB 929 threatening to change the fundamentals of chiropractic to include pharmaceuticals with no oversight. It would pose severe challenges to the licensing of chiropractors in the state and for specialists coming in from out of state. So something to note that if legislation is coming down the pipeline that would seek to fundamentally change primary care practices, it would ultimately create a large problem for licensing moving forward. And we want to know what the plan would be for that.
Thank you, Dr. Davis.
Thank you.
Ms. Sullivan, any other hands raised? Okay, there's no more hands raised. So we will end public comment. Thank you so much, everyone. We will see you at our next meeting on March 13th at 10 a.m. Thank you. Meeting is adjourned.